Hello and welcome to Good Life, the health show with me, Pooja. Well, viewers, back pain is a very common problem and will affect many of us at some point during our lives. Well, the good news is that in most cases, it isn't a serious problem and it might just be caused by a simple strain to a muscle or ligament. But as far as possible, it's best to continue with your normal everyday activities as soon as you can to keep moving. All right, to discuss on this, we have with us Dr. Chetan Kabra from Apollo Hospital. He is the senior orthopedic surgeon. So not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. All right, thank you so much, Dr. Chetan Kabra, for joining us today in Good Life, the health show. And today the topic which we have taken is back pain, which is very commonly seen these days, or which is very commonly seen in everybody. So at first, what do you have to say about what kind of a treatment or the procedure or the back pain symptoms and signs we are going to talk about? But at first, how would you like to start with?
Yeah, good afternoon, Pooja. Thank you so much for inviting me today in your live talk show. And to start with, I would like to start with certain statistics to make things clear for people in general to understand about back pain. So I won't be wrong if I say that 80% of the people who are actually viewing us live at the moment have either suffered from back pain or will suffer from back pain at some point of time in their life.
Absolutely.
Which means it is the second most common reason why a patient visits a doctor.
So this is actually, and this is very true, that this is a very common disease, and a back pain is very commonly seen these days. And if we talk about the average age group, so do we have an average age group of back pain, doctor?
Yeah. You will be surprised to know that the average age group for back pain is 20 to 50 years.
Okay.
Which means the working population of any country. In fact, you will be even more surprised if I tell you that the most common reason why a patient takes leave from work is back pain.
So this is anything related to the lifestyle which everybody is leading these days, and this is actually related to the lifestyle which a person or an individual is leading, because as the average age you have mentioned is about 20 to 60 or 20 to 50 age, which is very common and which is the age group of a working person, isn't it, doctor?
Yeah, in fact, to start with, I would like to say that we human beings, we are not supposed to bend forward. I mean, human beings are the only so-called animals in the world who can walk on two legs. We can run, we can jump, we can stand on one leg. So, but when we sit for hours together, against gravity, for example, say because of COVID, people are working from home, Otherwise also, like because of these computers and laptops, we have been sitting for hours together. So when we sit for hours together, our back becomes very weak and also the posture changes completely. So definitely lifestyle has played a very important role. Also, to make you understand better, normally our back muscles and the front muscles, the abdominal muscle, they work in tandem.
Okay.
They pull each other down and we stand straight. Now imagine when the tummy bulges out and the abdominal muscle, they become weak. The elasticity of the abdominal muscles become loose and they become weak. So our back muscles have to do almost 3 times more work, to keep ourselves straight against gravity. So definitely lifestyle has played a very, very important role. The inactive lifestyle is an important reason why people are suffering from back pain more commonly.
All right. Now, doctor, what do you suggest to these the ones who work from home, as during this pandemic, it has become a norm these days, working at home. So what do you suggest? Do you suggest them to get up for a few seconds or few minutes from their chair and take a walk and come back again and sit and then proceed with their work which they are doing? What do you have to say on that? Any normal functions, any normal exercises which you can recommend at home?
Pooja, you have talked really what I was supposed to tell you. Ideally, every person should not sit for more than 20 to 25 minutes at a stretch. Every 20-25 minutes, people should get up walk a little, stretch their muscles, relax, and then sit again. Prolonged sitting has to be avoided. Also, when we are sitting, we should make sure that the back is in contact with the backrest. In case we have to stand for longer duration,
Okay.
we have to make sure that we put one of our foot on the footstool, so that the center of gravity shifts from the back towards the knee joint.
All right. Doctor, we'll come to that exercise and also to the procedure to have a ease lifestyle. But we have a caller at this point in time. Let's take the call and then we'll proceed with the conversation. Hello? Hello? All right, there is a technical difficulty with the caller, but you were talking about the postures to be taken while working from home, or if a person is sitting for long on a chair. So what are the things one can do? So you can put a chair, or you can put the position how long? What do you have to say, doctor?
As I told, we have to make sure that the back is in contact with the backrest when we are sitting.
Okay.
And in case there's a gap too much, then we can put a cushion or something. Ideally, every 15-20 minutes we should get up, we should walk, we should stretch our muscles, and also back strengthening exercises. As I told, we have to make sure that our abdominal muscles are strong enough, the core muscles, and also the back muscles. So which means if we do the exercises sincerely, religiously, regularly, our back will be strong enough to bear our weight against gravity.
All right. Doctor, we have a caller. Let's take the call first. Hello?
हेलो
আমি শুনি আছো আপনার প্রশ্নটো কৰিব
गुड इवनिंग डॉक्टर मेरा नाम सुनील शर्मा है मैं गुवाहाटी खानापाड़ा से का रहने वाला हूँ डॉक्टर मेरा बैक पेन सीरियस बैक पेन होता है कभी कभी और एक्चुअली मैं पहले राइडिंग करता था हॉर्स राइडिंग करता था तो कई बार गिरा भी हूँ घोड़े से जिसके कारण जो है ना बैक पेन मेरा सीरियस रहा है एक बार मैं हॉस्पिटलाइज भी हो चुका हूँ तब से क्या है अभी मेरा वो राइडिंग तो मैं छोड़ दिया मेरा छोड़ा हुआ 8 साल के करीब हो गया है लेकिन सीरियस अभी भी डॉक्टर पेन होता है तो बहुत ज्यादा दर्द होता है तो इसके लिए कुछ सजेशन डॉक्टर
अगर आपका पेन 6 हफ्ते से ज़्यादा का है तो डेफिनेटली आपको एक बार डॉक्टर को दिखाना चाहिए। वैसे अगर आप बैक एक्सरसाइजेस कर रहे हैं और आपका पेन कंट्रोल में है तो इसका मतलब इतना ज़्यादा चिंता का बात नहीं है। आपका दर्द सिर्फ कमर में है या पैरों में भी जा रहा है?
नहीं डॉक्टर कमर में ही रहता है दर्द तो और कभी कभी ज़्यादा जब दर्द होता है तो बेल्ट बांध के रखना पड़ता है डॉक्टर लेकिन और एक सवाल था
नहीं बेल्ट तो
हेलो हेलो
या
हाँ डॉक्टर और एक सवाल
बेल्ट इज नॉट द सॉल्यूशन फॉर योर बैक पेन
अजी डॉक्टर एक और सवाल था मेरा जो डॉक्टर जिसे मैं दिखाता था उन्होंने कहा था कि आप बाइक चलाना में क्योंकि सिटी में वो काम करना तो बाइक से ही चलाना पड़ता है तो बैक पेन के लिए उन्होंने कहा था कि बाइक चलाना आप बंद कर दीजिए तो अभी भी मतलब मैं चलाता हूँ लेकिन थोड़ा कम चलाता हूँ डॉक्टर तो ये क्या इसके कारण भी हो सकता है क्या बाइक जो कंटिन्यू मैं रखा हूँ चला रहा हूँ जिसके कारण दर्द अभी भी हो रहा है?
देखिए बैक पेन का बेस्ट पार्ट ये है कि कहीं ना कहीं हमारा शरीर हमें बोल देता है कि इस कारण से ये पेन हो रहा है। अगर आपको बाइक देख के लगता है कि आज फिर से मेरे को बाइक चलाना होगा आज फिर से मेरा कमर में दर्द होगा तो कहीं ना कहीं यू विल हैव टू एक्सेप्ट दैट यस इट इज़ रिस्पॉन्सिबल फॉर योर बैक पेन। तो और जो चीज़ से आपका पेन बढ़ रहा है उसको आप डेफिनेटली अवॉइड कीजिए या फिर उसको यूज़ करने का तरीका चेंज कर दीजिए। एंड बैक स्ट्रेंथनिंग एक्सरसाइज डेफिनेटली इज़ द की टू योर प्रॉब्लम वो तो मैं बोल ही चुका हूँ आपको।
All right, thank you so much for calling at this point in time, and I'm sure the doctor which has given you answer must be benefited with the questions you have just asked. Now, doctor, like the person who has just called was asking about the back pain, and the prolonged back pain should not be avoided as you have already mentioned. If it is a prolonged one, you should immediately go and see an orthopedic, isn't it?
Very true. In fact, the recommendation world over, be it the NICE guideline of UK or be it most of the guidelines of America, is first 6 weeks of back pain in a comparatively younger age group between 20 to 50 years, without any history of radiating pain in the leg, without any history of weakness, without any history of bowel bladder involvement, can be treated conservatively without even showing to the doctor.
Okay.
If the pain persists for more than 6 weeks, definitely the patient should visit a doctor, or in case there is weakness of the leg, or in case there is tingling sensation, numbness in the leg, they should visit the doctor immediately.
All right. Now, doctor, if I need to ask you that these back pains, the ones who are suffering from back pain, does it also affect your other organs as well? Suppose if a person is riding bike for a long time and if he or she feels a back pain, so does it also affect your tailbone as well, and it also gives you a long time pain?
See, a tailbone is a different pain altogether. We should not consider it or classify it as a back pain. But tailbone pain is mostly because of sitting on a hard surface.
Okay.
So once we get rid of the hard surface, most of the times the pain reduces or disappears.
Okay. Now, if we say about the back pain, so do all back pains need surgery, doctor? Is there anything? Because like if a person hears about surgery, they might have a confusion in their mind that has it been related to some kind of a major disease? What do you have to say on this?
Well, I have to add quite a few points on this actually.
Okay.
Most of the times the patient comes and they tell us, sir, etu slip disc hobo pareniki. More slip disc to hua nai.
Okay.
So let me assure you, we have more bones, we have more ligaments, we have more muscles in our back than our disc. And I would like to give an example also. Every 55-year-old patient that I see has got grey hair. And also every 55-year-old patient, when I get the MRI, there is some disc bulging out. So there has to be some correlation with age also, with age definitely there will be degeneration of the disc and the disc will protrude. So slip disc being the cause of pain and needing surgery is extremely rare, to be honest. 70 to 75% of the times, most of the back pain is mostly because of the ligaments, the muscles or the tendon.
Okay.
And because of degeneration, mostly the disc comes out, and not all disc prolapse need surgery. Only in a very selected cases where there is weakness of the leg, where there is sensation issue, where the tinglings and numbness is like so severe the patient is unable to sleep in the night. Only in those cases we think about surgery, and the most common surgery is a laminectomy or a discectomy, which can be done both endoscopically and open.
Okay. Now, what is the first thing you do or your hospital does when any of the patient comes with back pain? Do you suggest them for an X-ray or an MRI first, and then you diagnose the entire procedure about it?
Well, again, I have to give some statistics to it. MRI, only in 1% of the patient can diagnose the cause of back pain.
Okay.
This has been proved beyond doubt by various articles. So when the patient comes and they insist for MRI, I try to convince them that there is no need of MRI if the pain is of less than 6 weeks and there is no neurological deficit. Sometimes, when we do the MRI, we get a disc and the patient thinks the disc is the cause of pain, which may not be the cause of pain at all. Honestly, if I get my MRI done today, there might be some bulging disc from L4, L5, L5S1 level. But that doesn't mean that is the cause of my pain, because I don't have any pain in the first place. So, and coming to the X-ray, I mean, frankly speaking, I am not very much in favor of getting an X-ray done for the lower back. You will be surprised that one X-ray of lumbar spine is equivalent to 365 chest X-rays, which means the radiation which suppose a young female who is not married will receive because of the X-ray is tremendous. And all we can see in the X-ray is bones, and bones may not be responsible for the pain in the back.
Okay.
So first 6 weeks of back pain, in fact, no investigation is needed. It's just a clinical diagnosis which the doctor can examine and tell very clearly there is nothing serious to worry.
All right. We will also come back to the treatment procedure and also to know about the cause of back pain, which everybody has a question in their mind. But right now, doctor, we have to slip into a short break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and we are having a fruitful discussion with Dr. Chetan Kabra on back pain, which is very commonly seen these days. Well, doctor, coming back to you again, if we talk about the problems which a person is facing due to back pain, now, if we have to change our lifestyle, which you already mentioned about the sitting position while working, now, if we talk about the sleeping position, like what kind of bed one should use if a person is suffering from back pain. So what do you have to say on that?
Yeah, you have asked a very good question, Pooja. Very commonly patients come and ask, sir, do we need to sleep on a hard surface or on a soft surface? Well, the recommendation is the bed should not be very hard and the bed should not be very soft. It should be just ideal that your normal posture of lumbar lordosis and thoracic kyphosis is well maintained even while sleeping. And ideally, if in case there is pain in the back, what you can do is you can put a pillow below the knee joint.
Okay.
That should help you. If you like to sleep side turn, in a side turn position, then you can put a pillow between the legs. You can put a pillow between the legs, even that will help you a lot in reducing the pain.
Okay, so these are some of the tricks which a person
and
can
we should always use a very thin pillow at night.
Thin pillow.
Yeah. Thin pillow.
Okay. Now, doctor, we have a caller. Let's take the call. Hello.
Hi, আপোনালোকৰ প্ৰগ্ৰামটো চাই আছো মই আসলে মোৰ বেক পেনৰ ওপৰত এটা কোৱেশ্চন সুধিব আছিলে জাষ্ট ডক্টৰে ক'লে যে মানে থিন পিলো ইউজ কৰিব লাগে আমি যে কেতিয়াবা দুটা বা তিনটা পিলো ইউজ কৰোঁ আৰু নহলে যেনেকুৱা ধৰণৰ আমাৰ কাৰ্লন না তেনেকুৱা ধৰণৰ মেট্ৰেছ যিবিলাক ইউজ কৰোঁ এইবিলাকে বেক পেইনক খুব বেছিকে পঢ়ায় নেকি মানে এইবিলাকৰ কাৰণে বেক পেইন হ'ব পাৰে নেকি বেক পেইন নোহোৱা মানুহৰো মই জানিব মানে ইচ্ছা আছিলে
Definitely hobo pare. In fact, frankly speaking, আমি যেতিয়া back কৈ আছো, back মানে আমি cervical spine পৰা lower back or পথা কৈ আছো. So, আপনি যদি neck বহুত বেছি bend কৰি ৰাখে, কাৰণ দুটা pillow use কৰে আপনার neck বহুত বেছি bend হ'ব, তাৰ মানে আপোনাৰ posture টো বহুত বেয়া হৈ যাব. So, posture বেয়া হলে definitely আপোনাৰ কঁকালৰ বিষ বা ডিঙিৰ বিষ আহিবই. So, whatever be the position, আমার posture সদায় maintain হ'ব লাগিব.
All right. So the position of your posture is very important while sleeping or while sitting because that relates to the major or the minor back pain and which can also affect your whole lifestyle. All right, doctor, if we talk about the exercises, if one person is doing at gym or at home, so rigorous exercises also puts your back to a pain, isn't it?
Very true. In fact, if you go to any gym, the trainers always ask you to maintain the posture. You know, if you have to lift, say for example, you have to lift weight from the floor. Ideally, you should bend the knee. So you should squat, lift the weight, and then get up. Our abdominal muscles are supposed to bear the weight, and the back muscles are supposed to maintain the posture. So which means we should bring the weight very close to our abdomen when we are sitting, and we should lift the weight and then get up ideally. So that's very important. And also posture, a single change in posture, a little change of posture can cause injury to the ligament, to the muscle, to the tendon.
All right, so these are some of the things. Now, doctor, we were talking about the MRI process and also about the X-ray. So you were saying that if any patient comes to your hospital or anyone comes, like what is the first thing as a doctor you do, or what is the first thing you tell the patient that, or you take up the history about them, that how the things went worst, isn't it?
Very true. I mean, history is very crucial. In fact, as soon as the patient enters our room, we see how the patient is walking.
Okay.
Even that gives us a lot of information. So, when it comes to history, our important questions are whether the pain is radiating to the leg and how much is the pain in the night, while sleeping. Even that is very crucial. We take the night pain little more seriously than pain during activity.
Okay. Now, see, are painkillers or the injections which also is been given during pain to have a ease of life. So, do you suggest those? Because we have seen many patients, like while having a major pain, they always take those painkillers. So, does it also affect your kidney? So that has to be stopped immediately.
Painkiller is not the solution for back pain. Let's be very honest about it. I mean, in fact, if the patient, many times patient comes with a acute catch in the lower back, patient is unable to move,
Okay.
severe unbearable pain in the back, maybe like because of lifting some weight or say like, pushing something. So, to be honest, it's actually a protective mechanism of our body to prevent further damage. So, what happens when there is a muscle injury, the muscles around that area, they go into severe spasm, and that causes acute pain.
Okay.
So,
okay.
for that, you have to give painkillers and muscle relaxant for 4 to 5 days. But in general, painkiller for longer duration has to be avoided, never more than 4 to 5 days.
All right, doctor, we have a caller.
It can affect the kidney, it
All
can
right.
cause severe gastritis.
All right, doctor, we have a caller. Let's take the call. Hello. Hello. All right, so the phone got disconnected. Yes, doctor, please proceed.
Yeah. So, painkiller is never the solution. As I told, change of lifestyle, change of posture, and exercises is the key. But here we are discussing the most common type of back pain which the patient suffers with.
Okay.
But then suppose if there is a history of loss of weight, loss of appetite, history of tuberculosis in the family or past history of tuberculosis with the pain persisting for more than 6 weeks, definitely you should visit a doctor and definitely MRI should be done to rule out those bigger causes. But less than 6 weeks of pain, no history of loss of weight, no history of appetite, no tingling sensation, numbness, no weakness, you can definitely treat it yourself just by changing the lifestyle and avoiding all those things which increases the pain. You just need to avoid that.
All right. Now, doctor, we have seen now a lot of support belts are available online as well to have a good posture while sitting. So, do you suggest your patients or do you suggest anyone to take those support belts to have a good posture or have a perfect posture while like working from home or if you are sitting a long time on a chair? Does it help?
See, honestly speaking, it's more of a marketing gimmick.
Okay.
I mean, that's my personal opinion. I have constantly been mentioning that back strengthening exercise is the key to the problem and we need to strengthen our back. So, if you are wearing a belt, be it a lumbar corset belt, or be it the kyphosis prevention belt.
Okay.
So, all those belts actually, causes more weakness to your back. So, in the long run, they are actually of a more disadvantageous position, for the patient.
All right. So, what do you suggest them that?
And also, it causes a psychological disadvantage.
Okay, psychological disadvantage. How so?
Yeah. Suppose you are wearing a lumbar belt, you're going to the office every day wearing a lumbar belt. Almost each and every colleague will constantly, they will ask you, ki hol, tumar bhal huana hai, kokalor big etiao hoye se.
Okay,
oh my
okay.
God,
Absolutely.
so these things, they start running in your mind,
So that puts you in a lot of stress.
Affect you.
Okay, doctor, we have a caller at this point in time. Let's take the
Definitely,
call.
it puts you in a lot of stress.
Yes, hello.
Hello.
আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
হয় মই ডক্টৰ চেতন কাব্ৰাৰ বেটচমেট মই ডক্টৰ শংখ হয় since I have been suffering from some time with back pain. Yes. So I just want to know that I've been suffering from acute back pain for last 3 years. So what kind of exercises would he suggest for patients like us? And there is a common saying, and this is a common advice also, that we should not keep standing for more than 45 minutes.
Okay.
Or we should not also sit in a particular place for more than 45 minutes or about an hour or so. So I would like to highlight on this problem that we face because we have a prolonged sitting or standing time in our profession. So how to avoid that? Chetan, this is Shankar here. Dr. Chetan.
Hi, Shankar. Hi, Hi Sankha, I have already mentioned
Yes, I have been suffering
if
with
suppose you have
pain
to
for
sit for more
last
than
few years. It has decreased, but the problems that I'm facing, I've just highlighted.
yeah, if if you have to stand for long duration, you can always put a footstool kind of thing where you can put your foot on the footstool. So what the advantage will be, once you bend the knee, the center of gravity will shift from the back towards the knee. So your pressure from the back will reduce and your back muscle will have to work less and you can stand for long duration. If you have to sit for long duration, as I have already mentioned, make sure your back is in contact with the backrest, and also every 20-25 minutes just get up and walk for some distance, just walk a little. Stretch your muscles, just relax the muscle a little and then sit again. Avoid prolonged sitting for like 45 minutes or 1 hour, not more than 20-25 minutes at a stretch. Give a break of 2 minutes. Also, so far the exercise are concerned, most of the exercise for the common back pain, I am talking about the common back pain which like almost 70 to 75% of the people suffer,
Okay.
will be back strengthening exercise, and the one single exercise which will make a huge difference is by lying on the abdomen and lifting your head up, something like this, you can lift your head up. So that will definitely strengthen your back and keep you more active and healthy.
All right. Thank you so much for calling at this point in time. And I'm sure you must be benefited with the answer Doctor gave. And Doctor, we are really short of time. So thank you so much for joining to Good Life, the Health Show this evening. And with this, we have come to the end of the show. And we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, to join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.